Are you or someone you know struggling with shortness of breath, a long-term cough, or wheezing? It could be more than just age or smoking. It could be COPD. COPD, or Chronic Obstructive Pulmonary Disease, affects more than 300 million people worldwide and is a leading cause of death and disability. In this video, we'll break down everything you need to know about COPD, its causes, symptoms, diagnosis, and how to manage it. So stay tuned till the end. PD is not just one disease, but a group of progressive lung conditions that make it hard to breathe. The two most common forms are chronic bronchitis, long-term inflammation of the airways with excessive mucus; emphysema, destruction of the alveoli, the tiny air sacs responsible for oxygen exchange. Over time, both lead to difficulty exhaling air, causing the feeling of being air-trapped. COPD is chronic, meaning it doesn't go away and usually gets worse over time. Let's start with chronic bronchitis. It is chronic cough with sputum for is greater than or equal to 3 months in 2 consecutive years. Causes: mainly smoking, also air pollution, dust, recurrent infections. Symptoms: persistent productive cough, shortness of breath, wheezing and chest tightness, frequent chest infections. Complications: pulmonary hypertension, right-sided heart failure, cor pulmonale, respiratory failure. Management: quit smoking, no smoking, inhalers, bronchodilators, steroids. Vaccinations: flu, pneumonia, pulmonary rehab plus oxygen in severe cases. Now what's about emphysema? Definition: a chronic lung disease where the alveoli, air sacs, are destroyed, leading to reduced surface area for gas exchange and difficulty exhaling. Causes: smoking cigarette, most common. Long-term exposure to air pollution or chemical fumes. Rare genetic cause: alpha-1 antitrypsin deficiency. Pathophysiology: destruction of alveolar walls, right-pointing arrow, fewer, larger air sacs. Loss of lung elasticity, right-pointing arrow, air trapping. Reduced oxygen exchange, right-pointing arrow, breathlessness. Symptoms: progressive shortness of breath, especially with exertion. Minimal cough, little sputum. Pink puffer. Appearance: which mean thin body build, pursed lip breathing, barrel-shaped chest, due to lung overinflation. Pulmonary hypertension, right-sided heart failure, cor pulmonale, respiratory failure. Management: quit smoking, no smoking, bronchodilators plus inhaled steroids. Pulmonary rehabilitation. Oxygen therapy if severe, surgery or lung transplant in advanced cases. What happens in the lungs? In healthy lungs, air flows easily in and out. In COPD, several changes happen. The airways become inflamed and narrowed. The walls of the alveoli are destroyed, right-pointing arrow, emphysema. The lungs lose elasticity, making it harder to push air out. Excess mucus blocks the airways, right-pointing arrow, chronic bronchitis. This leads to air trapping, reduced oxygen levels, and difficulty breathing. Symptoms: the symptoms of COPD develop slowly and worsen over time. Key symptoms include chronic cough, often with sputum or mucus. Shortness of breath, especially during activity. Wheezing and chest tightness, frequent respiratory infections. In later stages, fatigue, weight loss, and even swelling in the legs due to heart strain. If a person has these symptoms, especially if they smoke, they should get tested. Diagnosis: to diagnose COPD, doctors use spirometry test, the most important test. It measures how much air you can blow out and how fast. Chest X-ray or CT scan, to look for lung damage. Blood tests and arterial blood gases, to check oxygen and carbon dioxide levels. Early diagnosis is important because treatment can slow the progression. Lung spirometry findings in COPD. Key feature: irreversible airflow limitation. Down-pointing arrow FEV, forced expiratory volume in 1 second. FEV, FVC ratio less than 0.70, post-bronchodilator. FVC may be normal or reduced. Increased residual volume, RV, and total lung capacity, TLC, due to air trapping. Right finger spirometry confirms the diagnosis of COPD. COPD. Doctors use spirometry to measure how much air you can breathe out. The most important value is the FEV, or the forced expiratory volume in 1 second. Stage 1 Gold 1. The first stage is Gold 1, mild. Here, the FEV is greater than or equal to 80% of the predicted value. Patients may have only mild symptoms, like a slight cough or shortness of breath. Stage 2 Gold 2. The second stage is Gold 2, moderate. Here, the FEV is between 50 and 79% of predicted. Symptoms become more noticeable. Patients may feel breathless when climbing stairs or during daily activities. Stage 3 Gold 3. The third stage is Gold 3, severe. Here, the FEV is between 30 and 49% of predicted. Breathlessness is more severe, flare-ups become frequent, and quality of life is significantly affected. Stage 4 Gold 4. The last stage is Gold 4, very severe. Here, the FEV is less than 30% of predicted. Patients are at high risk of respiratory failure, hospitalization, and serious complications. At this point, oxygen therapy or even lung transplantation may be considered. Remember, COPD progresses slowly, and early detection is key. With treatment, lifestyle changes, and stopping smoking, patients can slow the disease and improve their quality of life. Management and treatment. There is no complete cure for COPD, but it can be managed. Lifestyle changes. The most important, quit smoking immediately. It slows down disease progression. Avoid air pollutants. Regular exercise and healthy diet to improve strength and immunity. Medications, bronchodilators, inhalers that relax airway muscles and make breathing easier. Steroid inhalers, reduce inflammation. Combination inhalers, bronchodilator plus steroid. Antibiotics, if there's a bacterial infection. Advanced treatments, oxygen therapy for patients with very low oxygen levels. Pulmonary rehabilitation, a program with exercise, education, and support. Surgery, like lung volume reduction or lung transplant in severe cases. With proper management, patients can reduce symptoms and live longer. Complications. If untreated, COPD can lead to repeated lung infections like pneumonia, pulmonary hypertension, high blood pressure in the lungs, right-sided heart failure, also called cor pulmonale, respiratory failure. These complications make COPD one of the most disabling chronic diseases. The good news is, COPD is largely preventable. Don't smoke, and if you do, quit. Protect yourself from dust and fumes at work. Get regular vaccinations for flu and pneumonia. Stay active and eat well. COPD is serious, but with early diagnosis, lifestyle changes, and proper treatment, people can manage symptoms and live a fulfilling life. COPD summary. Chronic Obstructive Pulmonary Disease, or COPD, is a long-term lung condition that makes it difficult to breathe. The two main forms are chronic bronchitis, which causes persistent cough and mucus production, and emphysema, which damages the air sacs of the lungs. The leading cause is smoking, but long-term exposure to pollution, dust, and chemicals can also play a role. Rarely, genetics such as alpha-1 antitrypsin deficiency contribute. Symptoms include chronic cough, shortness of breath, wheezing, and frequent chest infections. Over time, COPD can lead to serious complications like pulmonary hypertension, right-sided heart failure, and respiratory failure. Diagnosis is made with spirometry, which measures airflow limitation. The GOLD classification helps stage the severity of disease based on lung function. While there is no cure, COPD can be managed. Quitting smoking, avoiding pollutants, using inhalers and medications, and enrolling in pulmonary rehabilitation can greatly improve quality of life. Severe cases may need oxygen therapy or even surgery. In short, COPD is a serious but preventable disease. With early detection and proper management, patients can breathe easier and live longer. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health education. Drop your questions about COPD in the comments. We'll be happy to answer them.